A very good evening and welcome everyone. I, Dr. Ritika Dhiman, on behalf of Voice of Healthcare, welcomes all the speakers and the viewers who have joined in for today's discussion. Voice of Healthcare has taken an initiative to bring together the experts and speakers for today's session on winter health related problems in elderly, the care you need, which aims to understand the needs of the elderly during winters. I would like to commence this session by introducing our eminent speakers. So, for today's discussion, we have Dr. Anand Kumar Pandey, Director and Senior Dharamshila Narayana Superspeciality Hospital, Delhi. Welcome, Dr. Pandey.
Thank you very much. Thank you.
Dr. Sudheendra Ubdalker, Consultant Dermatology, Fortis Hospital, Bangalore. Welcome, Dr. Ubdalker.
Hello, good evening.
Dr. Preeti Chhabria, Consultant and Director, Internal Medicine Department, Sir H. N. Reliance Foundation Hospital and Research Center, Mumbai. Welcome, Dr. Chhabria. Dr. Mohit Sharma, Consultant, Orthopeadic and Spine Surgeon, Artemis Hospital, Gurugam. He will join us in a bit. So, as we all know, winter is here and it's a quite busy time with exciting get togethers, holiday parties, and family dinners. However, as we get ready for the charming winters, it is also important that we don't forget the unpleasant side of this season, such as the dip in temperature and other related factors that can lead to a multitude of health problems, also called winter diseases. So, starting with the discussion, I would like to ask Dr. Pandey, what is the effect of climate on your heart and what is the reason for increasing heart related problems in winters?
Very good evening, and thank you, Dr. Ritika, for allowing me to be in this forum. And I welcome my fellow panelists on this. It's a wonderful topic because Delhi is known for very bad winters. And once the onset of winter is there, there are a lot of changes in environment which really affect the elderlies. If you look at elderlies, I really classify them into two. One is the definition wise beyond 60 or 65, and then very elderly who are 80 plus, 75, 80 plus. So they are already suffering from hypertension and surgery or angioplasty. So that is a very common disease pattern which we see in Delhi NCR region in elderly patients. So that I'll discuss little later. But top of that, they have so many other issues like financial, social, emotional, personal. I have seen elderly parents are all alone. They are pulling the wheelchair. Their sons and daughters are settled down overseas. I think we have to take holistic care of health rather than only diabetes, hypertension, and blood pressure. The very important changes which happen, I mean, these patients, I always instruct my patients to get a checkup before the onset of winter because I have to adjust the doses for antihypertensive drugs and other blood thinners and drugs for cholesterol and diabetes. And then I always get a follow up once the winters are going off, like end of February or beginning of March. See what happens, Dr. Ritika, because winters you have a very less physical activity because of chill, cold. You tend to eat a lot because winters are known to have good quality food and very high, rich, fat, nourishing foods. Physical activity goes on. There is no sweating. And if you look at hemodynamics, the vasoconstriction is there, peripheral vascular resistance goes up. So, on an average, we have seen that blood pressure goes up by 20 to 30 millimeter mercury in winters on an average than in the summers. So, you have to really titrate your dose for blood pressure and especially diabetics. And I always advise them that they should have all the medications available. Maybe 1 week extra medication should be available. I'm not very rigid in controlling their blood pressure. It should be around 140 by 90. Because if you control blood pressure less than 120, 130 as in very younger generation, they may have a postural hypertension and giddiness. So good control of blood pressure and elderly is beyond 75, I think 140, 150, when I accept these readings also. So no hypertension, no sudden change in posture. They should get up. I always ask them to count 10 before changing a posture. So you're lying down, get up, count 10, then gradually stand up. because there are certain drugs which bring down blood pressure by postural fall. They should not be unattended. Same for diabetes. It is better to be on higher side of sugar rather than going to hypoglycemia, because hypoglycemia can really be very catastrophic for them. If they get one episode of hypoglycemia, they'll end up in emergency. And it has been shown that recurrent hypoglycemias can cause dementias and cognitive decline. Then it can precipitate cardiovascular disease. So, one checkup should be at the onset of winters with good control of blood pressure, because BP goes up. I always ask them to restrict their salt intake, because there is so much of salt in our diet. To restrict the salt, try to be as much possible as active, irrespective of the temperature. Do have schedule. See whether whatever is the season, whether it's winter or summer, they should have a structured life. Should get up in the morning, have some physical activities, have their medicines on time, should have good quality, low calorie diet. All these things are very important, whatever is the season or whatever is the. But winters are known to have these things. And very important is pollution is playing a very huge role. So pollution compounded with the hypertension and diabetes, I think, is going to have more toll on their health as compared to those who are living in a cleaner areas like Bangalore and Pune, and I think even Bombay, something like that. Delhi is known for very high AQI. So I think we have to have very good indoor air purifiers and good plantations. So all these things, small things, I think will really bring down their visit to hospital. They should have a doctor who is available on telephone, and we always support such patients to be available on telephone, because very minor glitches are there, very minor confusions are there in mind, which I think we should avoid them coming to hospital, and then we can manage all these things. So first visit at the onset of winter, and then another visit at the end of winter with good telephonic communication, storing of medications, taking a schedule, structured life, good diet, physical activity, good sleep, good moral, mental, social, physical support. I think COVID has taught us these things very nicely, that we should be socially connected and maybe physically distant. I think all these things can change their way of life.
Rightly said, Dr. Pandey, that pollution is playing a major role, especially during winters, on the health of elderly people. So, speaking of pollution, Dr. Preeti Chhabria, respiratory issues and infection aggravate during winter season. So, what are the common infections or respiratory illnesses which aggravate during this winter season? If we include pollution as well, especially in the elderly patients.
So, good evening, Dr. Ritika. And firstly, thank you for allowing me to talk on something which is very close to my heart, and that is the care of our elders. Now, geriatrics, which is really the science and the medicine of the health of our elders, is at the other end of the life spectrum with pediatrics. Now, both of these ends of our life spectrum share one common thing, and that is a little reduction in the immunity. So our kids in the pediatric section are still building their immunity, whereas among the elders, there's a wane or a decline in the immunity. For the simple reason of aging, there is a decrease in the number and the repertoire of the T cells. There's a reduction in the B cell count, which produces immunoglobulins. There's also a complete dysregulation of the immune responses. And this is what we call immunosenescence, or the aging of the immune system. On account of this, our elders are very prone to infections, particularly so in the winter season, where in general viral infections and respiratory illnesses are more common. And since they remain clustered within the household, these spread also rather easily. So viral infections such as rhinovirus, which is the common cold, we have influenza virus, which is the flu. Most recently, we've seen the COVID virus, then the respiratory syncytial virus. All of these are common in the winter winter season. More so, they spread easily because they are all tending to be close together indoors. Besides viral illnesses, what we also see is a flare up of the bacterial infections, such as the bacterial flare ups of sinusitis or even pneumonias, which our elders are particularly prone to develop. Due to the dysregulation of the immune system, they are also prone to various autoimmune illnesses. So, the lupus or even rheumatoid arthritis, with its afflictions on the lung and respiratory ailments, are more common in the elders. And also, what we see is the flare up of the allergic illnesses among the elders, more so in the winter, especially the asthma and allergic rhinitis, which have a particular predilection to spread in the winters because, as Dr. Pandey mentioned, there's a very high level of suspended impurities. So, these are the various ailments which are particularly common in the winter season.
Right, Dr. Chhabria, you have mentioned that the elderly people, they uh, rest in a closed environment, so the spreading of infection is more if you are not in the open air, and plus there are impurities in the airs as well in certain regions, as Dr. Pandey mentioned, especially in Delhi. In the winter season, the pollution also increases, so these actually curate to increase the infections, especially in the lungs and especially the respiratory illnesses. So coming on to the skin, so Dr. Ubdalker, apart from dryness of the skin, what are the other dermatological issues that you come across during your clinical practice in the winter season in the elderly patients?
Good evening, Dr. Ritika. Thanks for this opportunity. Uh, Predominantly during winters, and particularly in a place like Bangalore, where it is not very cold, but it does get very dry. huh? And Bangalore is always famous for their these allergies. A lot of pollen in the air, we say. So one is the dryness is a primary cause of most of the problems what arise in the skin. Right. So if there's a pre-existing psoriasis in a patient of elderly patient, that is likely to be flared up during the winter with us because of the low humidity. Second, if they have an existing chronic atopic dermatitis or allergic dermatitis or any sort of allergies in the skin, because of the lowering of the humidity, there's a dryness in the skin, which makes it more prone for all these flare-ups. So that's what we predominantly see. What we also see as a result of flare-up of these allergies, there can be some secondary complications which arise. Like I see a lot of common, a lot of my elderly patients coming with cellulitis. As a result of a allergic dermatitis which was always there in the leg, but which got flared up and then got secondly infected. So that all the spectrum of illnesses is what we commonly see in the skin during the winter.
So you have mentioned that there is increase in allergy due to the season and decrease in the immunity, which trigger the allergy. So what do you think are the common precautions that can be taken by our elderly to
See,
prevent this?
elderly, as I always tell my patients, moisturizing is something which has to be ongoing, not only when the problem arises. Many a time, what patients tend to do is, as they get better, the motivation to use a moisturizer kind of goes away. So, at least in Bangalore, I always tell my patients that you have to use it starting from September till February. Right. Many a time, what happens is, in elderly, particularly applying a moisturizer all over the body immediately after bath is a hassle. You know, it's something which is very easy for us to say, but very difficult to follow. Right. So we always say lukewarm water bath. Don't take very hot water showers. What generally happens is elderly they feel a little more cold, so they take very hot water. Hot water dries the skin, and we say minimize the use of soaps. Liberal use of soap or rubbing the skin with soap again removes the fatty content of the skin, and it depletes the skin of its water holding capacity. So we always say use less soap. I always encourage my patients to take oil bath, like you apply some oil nicely, leave it for an hour, and then take bath. Do it once in a week, twice in a week. And moisturizer, anything. Nowadays there are some very good moisturizers which are available with easy spreadability. Most often elderly we give them a lotions, which are very easy to apply. And always educate that moisturizer needs to be applied immediately after when the skin is still a little damp. Like you wipe it, the skin is still a little time. That's the best time to apply a moisturizer. Generally, the notion is before sleep I'll apply a moisturizer. It's not very effective. It's not very effective to apply a moisturizer. If you want, you can apply another layer of moisturizer at night. But one application immediately after the bath is the most important part of applying a moisturizer. Now there are even some emollient oils which are available to put in a bathing water. Like if ideally they were made for tub baths. You put these oils in the bathing water and soak your body in it. Okay, but now we say if in a bucket of water you can add this. But with elderly, this can make the bathroom floor a little slippery. And if it causes a fall and all those things, then it becomes a problem. But there are some newer ones available which don't have these, very slippery oils. All these are options which can be used to maintain the skin, in elderly during the winters. But whatever is done, it has to be done in an ongoing manner. Okay. So that they're able to sustain whatever improvements they are doing. Because even when you start applying a moisturizer, it takes 3 weeks for a moisturizer to work. So it's not that you just apply a moisturizer and it is effective tomorrow morning. So we have to educate them that it has to be used continuously to get the desired results.
So Dr. Udbalkar has given us different tips on how we can decrease the dryness of our skin, especially moisturization and well, before bathing, actually, not after bathing. So and also we have discussed about heart, lungs, and skin now. So Dr. Sharma, I would just want to ask you that winter comes with a concern of mobility issues in elderly. Is it the age factor or climate factor associated with it?
So when we talk about mobility issues, so in elderly patients, what I've seen in my regular practice is that it's not just one thing which is going to be a causative for causing any stiffness or causing them mobility issues. Mostly it is multifactorial. So climate does have a role. When winters are there, the patients usually coming to you in the OPD are not doing a lot of physical activities, and it definitely degrades and causes them more stiffness and arthritis. And secondly, what I feel is as the age advances, the four problems that we feel are there is muscle weakness, is joint arthritis, and the third thing is decreased bone density. Decreased bone density, muscle weakness, and joint stiffness. They're all something which affect people and the elderly age, and they lead to a lot of mobility issues with these patients.
Yes, so you discussed about the mobility issue, including arthritis. So it is not just the age factor or just a
Yeah,
climate factor. It is a multifactorial kind of a thing
yeah,
which occurs in the
yes.
bones of elderlies. So
And
we have
probably
now
that is
covered.
why what I always feel that elderly patients should be encouraged physical activity. For them, the physical activity should not be going to a treadmill and a gym, or say going for doing some more exercises for their joint. What they need is a daily walk of 15 to 30 minutes, and that should be 3 to 4 times in a day, usually in the early morning, so that they are more respondent to the cold atmosphere in the winters. And then they should have some joint range of motion exercises, like you should have your shoulder movements should be proper, you should do your proper rotations regularly. It should be like for 5-10 minutes, but that should be there regularly, and these things can decrease mobility issues in elderly.
Yes, probably, they can do yoga for their stretching exercises, to maintain the rotation of every joint. I think it will be a good
Yeah,
exercise.
yes, yes.
And they don't have to, pay much for these. They just can open a YouTube channel and they can learn yoga from there. And also, you have rightly mentioned that, 15 minutes of just walk can be done, and not just going to expensive gyms, but just
Exactly.
a walk of 15 minutes, 2 times, 2 3 times a day will be
And
beneficial for the bone issues that the elderly patients have. But especially during winters, people don't usually are physically active. They don't usually go out to just for even a walk because of the weather situation. So in those conditions, what can be done?
So usually, if people are not moving out for walk, it is just encourage them to do some small activities in the house. They can go just roam around in the balcony or roam around in the corridor. See, by moving around, what you're doing is not only improving the joint mobility but also increasing the nutrition and going to your bones. That affects your weak bone mass. So some amount of movement can it be? It can be in your house. It can be outside your balcony or in the small garden. If they cannot go around in the cold environments in the outside environment, but it has to be there. So you cannot stop them. Any activity should not be stopped in elderly. What I tell every patient in their elderly age is that you need to keep your joint subtly moving, and it should always have some mobility in it. Even if a patient is suffering a frozen shoulder, he comes to me, he says that my range of movement is not going beyond say 90 degrees, it's a lot painful for me. I only suggest them to just do small mobility exercises, wait for 10 months, 11 months. It's a self-limiting disease, it will go down, but just by subtly doing some joint mobility exercises, you can be rid of these mobility issues.
Right. Yeah. You should not stop, whether it's a season or something else. There should be some kind of mobility that should be going on. So, we have discussed an era of diseases, like we have discussed about heart, lungs, skin, and the bones itself. So, Dr. Pandey, what are the common precautions or lifestyle changes that can be done to prevent heart related problems, especially in the winter
Yeah,
season?
yeah.
I think I have already discussed a lot of issues earlier also, but when it comes to preventing the disease, they must maintain their numbers of blood pressure, sugar, cholesterol, and medications. That is most important. They should not take it lightly. Avoiding of extreme cold is very important. They should not go for morning walk in very early morning when it's a chilling cold. They can go to park or for a walk when there is a little sunlight and it's not that chilly winter. So delaying the walk is very important. As Dr. Mohit has said, they must be physically active.
Yes.
So whenever they get opportunity to walk, they must walk. That is the idea. Then avoid gaining weight, because I have seen winters they really tend to gain weight. Even we as a doctor gain weight because of such a good food habits are there, and gajar ka halwa and mungfali and gazak and all that. I think they are all tempting, but I think we should avoid maintaining good body weight. Adequate hydration is very important. We take we must no around 2 to 2.5 liters unless there are conditions like heart failure or kidney dysfunction. Otherwise hydration is key not only for good health, but I think even joints get better lubrication. And as Dr. Udalker has said, the dryness and all that all can be prevented by good hydration. Then last is very important is must have your glucometer, your blood pressure instruments handy. I had a patient who, because of anxiety, his BPS has gone up. He had to visit to hospital where his blood pressure was found to be normal. So that anxiety sits in a whirlpool where the patients are a little worried. My sugar has gone down. My BP has gone up. We must know how to measure our blood sugar and blood pressure. I think COVID has taught all these things very nicely to maintain minor health issues at your own level. And then more important is early recognition of symptoms. I have seen there is a lot of people mistake these symptoms as a gas, and when they go for an ECG, they find there's a heart attack. See, for a stroke, any weakness in any limb or any part of body, deviation of mouth, excessive salivation, I think they must have. I'll request you, Dr. Ritika, to have such warning red flag signs for elderlies who can, if any notice anything, these abnormalities, they must report to a doctor. And Dr. Preeti has really pointed out very nicely. I think we are routinely advising all elderlies for vaccination of, I think, pneumonia and influenza, because one hospitalization because of these reasons derails their health to a large extent. I think taking these measures, avoiding certain things in winters, good medical treatment, good mobility, good hydration, and good vaccination schedule. For there is a whole a lot of adult vaccination programs. I think all these things, if incorporated in a nice way, we can have very good health for elderly. I think very soon we will be landing in those zones. So we should be prepared for. At least I can say that we must be prepared for those things, not only to tell about these things. Thank you very much.
Yes, thank you, Dr. Pandey. You have rightly mentioned that I should take this opportunity on this platform, to let people know the early signs of, heart disease. So, who will be the right person to tell besides you? So, I think you can tell us a little signs and warnings for a heart disease which patient can take care of if you would like to.
Yeah, yeah. So, see, I always say, I mean, first of all, let the doctor say that it is not heart disease. You should not diagnose your symptoms. Any individual, any person, forget the people in the group. Any individual who has a jaw pain, lower jaw pain, and chest pain on both the sides, going to back, going to both arm, going to both this shoulders. He is feeling sweating. He is feeling uneasy. He is feeling unexplained indigestion, gas. He cannot walk for few steps. And I think there is a very important feeling defined in books is feeling of impending death. I am not due to survive. Any such chest pain must be reported to doctor rather than taking Eno and Pantocid. I think this I have seen a lot of patients come to emergency. You get an ECG done, you find that they had a heart attack yesterday and it has been missed because golden hour is 6 hours. If you miss a heart attack in first 6 hours, I think it is a great injustice to patient, and I think he is doing his this injustice to himself only. So warning signs are very important. How to recognize early heart attack or early stroke is another very important point. Which we must have a public awareness programs for this.
Right.
And
So you have rightly said that patient should be aware of these symptoms, their symptoms, and yes, you were saying something, Doctor
they must get an
Pandey.
ECG. At least one ECG, which is normal, then they can get another ECG later on. But one ECG can virtually rule out a major cardiovascular disease. At least those who are not willing to accept their symptoms. So we must do ECGs. There are certain markers are there like drop by CPKMB to go for further details. But let the doctor advise that it is not a heart disease. They should not diagnose themselves for their symptoms.
Yes. So the point that we can take up here is that people should visit their doctor. They should have their regular checkup done with the doctors because they are the person who will tell you that if it is a heart disease or not, if it is a gastric disease or not. So you have rightly said, Dr. Pandey. So, Dr. Chhabria, so there, what are the special care needs that need to be kept in mind during winters, and not just in winters, for asthmatic and patient with chronic obstructive pulmonary diseases?
So we want to prevent, these are chronic illnesses which last forever. What we want to do is prevent acute flare ups of these illnesses, whether in winters or throughout the rest of the year. So, as Dr. Pandey mentioned, the first important thing is to prevent infections which actually cause a flare up of these, whether it's asthma or the COPD exacerbation. The two important vaccines which are readily available is the flu vaccine, which is to be done annually, and that is to be done in the Indian setup very a little before the onset of the monsoons, because that's when the new flu strain comes about. The pneumonia vaccine should be encouraged amongst all our elders over the age of 65. And that needs to be touched upon every 5 years or as the season goes. For some with pre existing illnesses, which the doctor can identify, they should be done even before the age of 65. So these two actually help, these two vaccines help to prevent a large chunk of infections which can cause flare ups in the asthmatics. Now, in terms of environmental control, we do see that after Diwali, there is a huge collection of suspended impurities in the environment. So, if you're particularly going to get exposed to such outdoor activities. Masking is a good idea. Nowadays, masking is socially acceptable, so that should be encouraged amongst the asthmatics. Um, Prevention of exposure to triggers. So, avoiding pets in the bedroom, because that gives uninterrupted exposure through the night. Looking for any molds in the house, especially if we use humidifiers at home. Make sure that those are cleaned out. The heaters that we use, no mold collection over there, because mold is also a great trigger of asthma and respiratory flare ups. Avoiding any exposure to secondhand smoke. That is also a strong trigger for the asthma flare up. Besides this, certain other illnesses like acid reflux or obstructive sleep apnea, those should be controlled to prevent an asthma or a COPD flare up. The other thing that I would recommend and encourage all our elders who have this diagnosis is to keep up with their inhalers. There's no shame, there's no harm. I get this a lot. People say, "Oh, I'll get addicted to that. My body will get used to it." There's no such thing. If a simple use of an inhaler can prevent a major flare up which requires oral medications, that should be encouraged and should be kept up with. The important thing with the use of the inhalers is a gargle right after the use of inhalers. Even nasal hygiene and the nasal rhinitis control is important to keep the lungs healthy. And whenever an oral medication is added, especially by our cardiologist friends and colleagues, we always should have our asthmatics remind them that they are asthmatics. So they can choose the cardioselective beta blockers so as to prevent flare-ups of asthma. And in general, whenever medications are added on, drug-to-drug interactions have to be looked at for our elders because they are always candidates for polypharmacy. So using these judiciously can prevent a chunk of flare-ups.
Yes,
Thank
you have mentioned that vaccination is important. Use of masks, so there is no taboo around masks right now, especially after COVID. And then be on inhalers. If you should carry on inhalers. Asthma is not a taboo anymore in the society. And the fourth thing that you have really rightly mentioned, that you should be very clear about your history, because in elderly it tends to have cardiovascular disease, respiratory illnesses, and there can be a chance of polypharmacy. So basically, multiple side effects can aggravate other diseases. So that is which I have rightly mentioned, that they should be very clear about their history to their doctors, to different doctors. So the foremost thing is that you should keep your doctors aware about the type of medications that you are taking. So so now moving on to Dr. Ubdalker. So there is a decrease in elasticity of skin, with age. So you have already mentioned moisturization and maintaining hydration. Apart from that, what are your other recommendations which can help maintain better skin with age? The aging, obviously there is wrinkles, and there is decrease in elasticity. So what other recommendation that you can discuss about here, so that with age their skin is possibly not as old as they get. It doesn't look that old. So what are your
Okay.
yes.
See, the skincare is something which has to start early. Okay, it is something which has to if you're wanting to stop your fine lines, wrinkles, and all those things. There is something we say that 50% of your skin is constitutional, what you're born with. Like your genetics, your family history determine the health and the nature of it. Huh? So 50% is non-modifiable, you cannot change it. Okay. The remaining 50%, 30% is good health, good lifestyle, good nutrition, adequate hydration. Sometimes the focus on these areas is actually reducing. Right. Now, eventually the skincare is getting, approximated with, what I say, like what are you applying, what are you washing. Like, the skincare is not just what you apply and what you wash it. You know? It's much beyond, just application and washing. Because your health, as we always say, talk, skin is a mirror of your health. If you're healthy, the skin will look healthy. Okay? So overall, good diet, good lifestyle, avoidance of smoking, adequate sleep, plenty of water. All these are equally relevant in maintaining your skin and preventing these changes. They are basically cumulative damages which happen in the skin as we go on. Good use of a moisturizer, particularly if your skin is dry. Use of a sunscreen on a regular basis. Whenever you're out. See, the general perception among people is I'm not exposed to sunlight. Most of my patients tell, they do have a sunlight-induced allergy, but they say I'm not exposed to sunlight. So they say I go in a car. My car has air conditioning. My car is always air conditioning is on, so it doesn't matter. So that there is a lot of there is underestimation of your exposure to sunlight. Windows, balconies, they can all also be sunlight. Now they say even a mobile blue light, infrared damage to the skin is all being, newer sunscreen now they come with blue light protection, infrared protection, and all this. Adequate use of a sunscreen, but don't go overboard. Also, use your sunscreen properly. Another common problem what I see in Bangalore is there is no sun in Bangalore. Like 8 9 months in Bangalore is cloudy. So they say there's no sun. No, cloud doesn't make any difference. Even if it is cloudy, you have to use your sunscreen. 15 20 minutes before you step out, ideally 30 minutes before you step out. And if you're out in sun for more than 4 to 6 hours, reapply your sunscreen. And some of these retinol creams can be started as you get into your mid 30s, and all this thing. See, nothing can absolutely prevent a change in the skin. Okay. You can delay them, you can maintain them, you can, keep it there. Now, how, to what extent do you want to go for it is something, there's no end to it in dermatology as of now. Starting with the options to apply to what you can do with the skin. So there is no end to these things. But to be judicious, the most important thing will be good health, good lifestyle, sunscreen, hydrating your skin, avoiding smoking, all these things. 6 to 8 hours of sleep in the night, prolonged exposure to mobiles and all those things. Particularly in a dark room, you are seeing your mobile. So the amount of light which is falling on your face can be significantly, more. So all those things you will have to look into. And obviously, retinol creams can be used. Now, every alternate patients of mine comes and tell, I'm applying, vitamin C serum, I'm applying hyaluronic acid, I'm applying niacinamide. So, the amount of bombardment which happens, amount of information being available, whether you take Instagram, Facebook, there are videos, there are reels, there are products. Every time you open your Instagram, you get 10 ads, throwing up, you know, they are, I will not say irrelevant, but you really have to be very smart to understand how important they are. Don't get caught into trying thousand things on your skin. Keep it very simple. Hydrate your skin, use a sunscreen, eat well. A simple retinol cream can also help you in maintaining, preventing the long-term damage in the skin.
Yes, so you have very rightly said that, the skincare is not just on the surface. So it is not, you are applying, after seeing the Instagram ads that you have mentioned, that, you are bombarding your skin with different chemicals. So it is not just on the surface, it is also what you eat. So you have said that, nutrition, good nutrition is also, and a balanced diet is also a reflective of how your skin is. And you should avoid smoking. So you have set a very good example of how currently ads are running on Instagram, and they have certain routines. So there are 6 7 creams that are, uh, the message is that it is not just skin, is not just on the surface, it is how you eat and how you take care of it. Apart from, obviously, the retinol and any other skin routine is there, but apart from that, your nutrition is also one of the key areas that you should look into if you want to have a healthy skin. So yes, so We have covered heart, lungs, skin, and now Dr. Sharma. I just want to ask that are there any supplements or other dietary changes that needs to be done in elderly with respect to their bone health?
So this is something I have always wished to talk about. So normally when patients come to the OPD, a regular practitioner would always write and recommend that he should have a high protein diet, a low salt diet, and the patient should eat less oily food and spicy food. But when it comes to the elderly patients, there are three things that we should need to understand. Those three things are very important, which are mostly missed by many people practicing regularly. One is that elderly have loss of teeth. Second is that they have reduced swallowing capacity. Third is that their digestive disturbances are at its peak. Usually, these patients are going to have a lot of gaseous issues, lot of bloating issues. So you have to address them accordingly. It is like handling a patient, an elderly patient for the nutrition and dietary modifications is just like handling a bicycle with so many spokes to it. So you have to manage it accordingly. Like in these patients, I recommend dietary modification that they should have vegetable soups, juices encouraged more. They should have mashed foods in their diet. Mashed food create a lot of difference with these patients. So they have and that goes with the mashed food. Even you can also add some amount of dalias and some amount of upmas to it, which are easily accessible to them. Rather than giving them the option of having bony meats or say high protein bushy beans and all those things, which can be very difficult for them to take in and swallow and also have digestive issues, I suggest them to have something which is easier for them. Vegetable soups, juices, mashed foods in their diet. These are some basic dietary modifications they can have. And then we have medications and supplements for their joint. We have good joint cartilage supplements available these days, which can again delay the process of aging, but it is inevitable. It is not something that you can stop. You can just delay the progress of aging and reduce the stiffness and muscle weaknesses with those supplements. But in the end, you have to have some balanced diet. And most importantly, elderly patients after 45, 50, they should have small, frequent meals. The meals should range from 5 to 6. They should not be traditional 3 meals, one breakfast, lunch, and dinner. They should have small bouts of meal and they should be frequent meals. And they should not chew more after 7 p.m., 8 p.m. in the evening. They should have something which is light so that they are able to go throughout the day.
Yes, so you have, told an important point that there are not much teeth left in elderly, so
Exactly.
that he can, eat the normal diet that as we eat. A mushed potato or a mushed diet or dalia that you have mentioned, and there are other things that they can do. You have very rightly presented, and there should be smaller meals, and frequent meals should be there, and they have also digestion problems and other problems that we have already discussed. So according to that, there should be a proper dietary needs that should be taken care of by the elderly. So
And one thing more,
yes.
I would like to say that in elderly patients, you don't have to stuff them with so many things. They have protein deficiencies, they have calcium deficiencies, they have multivitamin deficiencies, but you should be gradual in the process of improving their diet. You should be gradual. Do not hit all those deficiencies at one time. If you want to hit protein deficiency, increase it slowly with the diet, then come to the calcium deficiency by calcium supplements. Then you can add some vitamin D supplements over the period of time. But you should not hit them again in one go because they have reduced digestive capacities, and it actually has a lot of effect on the elderly patients.
Yes, yes, rightly mentioned that they should not be bombarded with everything that they are deficient in. So, are there any supplements that we are talking about which can overall take care of the basic nutritional deficiency in the elderly?
So for elderly women after 50, they should be put on regular calcium supplements, and they should continue the calcium supplements and keep checking on their vitamin D levels. And if a patient is a pure vegetarian, he should be put on vitamin B12 supplements regularly. Not much of vitamin B for a longer period of time because there have been some toxicities also seen with vitamin excess. So we do not push them for long periods, but we do give them at intervals. And thirdly, that what we can add some as supplements is normal multivitamin supplements, which should have zinc and selenium for the elderly people. and they're good enough for them to go, and they keep them quite happy.
Yes, so to address all these issues, you all have mentioned that you should be very basic. We should be very basic in our approach with the elderlies, because yes, they have very lesser digestive acids in their stomach, and they don't have much teeth. So less meals and frequent meals should be given to maintain their to maintain to decrease they also have decreased potential to eat, so they don't feel like psychologically they don't feel like eating much. So to maintain all the proteins and minerals and vitamins in their bodies, so we should be very basic about these things.
Yeah,
And
small.
first and yes, and first and foremost is that they should regularly visit a doctor, which we have learned today, with everybody thinking about the same thing, that frequent visit to the doctor, not just frequent, regular visit to the doctor, so that they can address your concern, and they can uh, uh, teach you in the right direction of how they can do, whether it's an orthopedician, whether it's a cardiologist, whether it's a dermatologist or a pulmonologist. So, with this note, I would like to end this very insightful and wonderful session today. So, I would like to thank all the panelists and the viewers who have joined in for today's discussion. Thank you so much, all the doctors, for taking time for this. Insightful discussion with us. You have enlightened so many viewers regarding all the problems. So, thank you so much. Thank you.
Thank you. Thank you.
Thank you.
Thank you very much.
Thank you very much.
Mm.